Apples and cheese. Alright, section 16.2, disorders of the eye. Disorders of the accessory structure of the eye occur separately, but often are a result of another accessory structure disorder. Eyelid edema can be a result of eyelid disorder, example style in chalazon, or is often produced by an allergic reaction due to cosmetics, pollen in the air, or stings and bites from insects. It can also be caused by conjunctivitis and dark cryostenosis. Ptosis occurs when the upper eyelid is constantly drooped over the eye due to paresis, partial paralysis of the muscle that raises the upper lid. It can be associated with diabetes, myasthenia gravis, brain tumor, and muscular dystrophy, all of which are described in previous subsequent chapters. The term blepharoptosis is used for sagging in the eyelids due to excessive skin. Okay. Blepharitis occurs when multiple eyelash follicles and tarsal glands become infected. The margin of the eyelid shows persistent redness and crusting and may become ulcerated. The infection is usually staphylococcal. A chalazion is a small, painless, localized, whitish swelling inside the eyelid when a tarsal gland becomes blocked. It usually disappears spontaneously. What do we have here? So we got ptosis and chalazion. Oof, and this is a sty. Okay. A sty or hordeolum is an infection of an eyelash follicle producing an abscess with localized pain, swelling, redness, and pus formation at the edge of the eyelid. Conjunctivitis has several causes. Viral and bacterial conjunctivitis are contagious. Viral, conjunctivitis. This looks horrible. Viral is commonly caused by viruses that cause the common cold. Bacterial is frequently due to staphylococcal or streptococcal bacteria. May be caused by rubbing eyes, sharing makeup that is not your own. Allergic conjunctivitis can be part of the seasonal hay fever or be produced by year-round allergens such as animal dander and dust mites. Irritant conjunctivitis can be caused by air pollutants, smoke and fumes, and by chemicals such as chlorine and those found in soaps and cosmetics. Neonatal conjunctivitis, ophthalmia notorum, can be caused by a blocked tear duct in the baby, by the antibiotic eye drops given routinely at birth, or by sexually transmitted bacteria in an infected mother's birth canal. Dry eyes are a common and chronic condition with over 75 million Americans suffer from. It's due to the tears losing water and becoming too salty so that the eyes sting and burn and vision becomes blurry. Dacrostenosis is a blockage of the drainage of tears, usually due to narrowing of the nasocrimal ducts. Approximately 6% of newborns have this condition, but it may not be noticeable at birth because infants do not produce tears until they're several weeks old. Fortunately, nearly all blocked ducts open by the age of 1 year and do not require surgical opening. Dacryocystitis, cystitis, dacro, whoa,
Dacryocystitis.
Dacryocystitis is an infection of the lacrimal sac with swelling and pus at the medial corner of the eye. Disorders of extrinsic eye muscles. Strabismus, squinting, is a loss of alignment of the eyes due to muscle control. Types of strabismus are exotropia, an outward turning of one eye, esotropia, which is cross-eyes. I always wondered if people were cross-eyed, if somehow they could see straight. Is the eye turned in towards the nose? In congenital or infantile estropia, both eyes look in toward the nose. The right eye looks to the left, and the left eye looks to the right. Accommodative estropia is caused by uncorrective hyperopia, a refractive disorder. An eye will cross when attempting to keep a distant object in focus. Alright, so we have accommodate, verb, to adjust something to make it fit its needs. Accommodation, noun, the act of adjusting something to make it fit the needs. Accommodative, willing to adjust to create agreement, adjective, okay. Blepharitis, inflammation in the eyelid. Blepharotosis, drooping of the upper eyelid. Chalazion, a cyst on the outer edge of an eyelid caused by a blocked tarsal gland. Conjunctiva is inflammation of the conjunctiva. Contagious, able to be transmitted as infectious, transmitted from person to person, from person to air, from surface to person. Dacryocystitis. Dacryocystitis, inflammation of the lacrimal sac. Dacryostenosis, narrowing of the nasolacrimal duct. Esotropia, a turning of the eye inward toward the nose. Exotropia, a turning of the eye outward away from the nose. Hordelum, abscess in an eyelash follicle, or stye is a synonym for hordeolum. Infectious, capable of being transmitted or caused by infection by or microorganism. Ophthalmial neonatorium.
Ophthalmia neonatorum.
Ophthalmia neonatorium. Conjunctivitis. God dang. Conjunctivitis in the newborn. Paresis is partial paralysis. Ptosis is sinking down of an eyelid or an organ. And strabismus, strab means squint, a turning of an eye away from its normal position. Alright, so disorders of the anterior eyeball, the anterior eyeball. Corneal abrasions can be caused by foreign bodies, direct trauma such as being poked by a fingernail or badly fitting contact lenses. The abrasion can grow into an ulcer. This is a fluorescent-stained corneal ulcer. Yeah, so, okay. Scleritis, inflammation of the sclera, the white outer covering of the eyeball, can affect one or both eyes. It causes dull pain and intense redness, and is often associated with rheumatoid arthritis and the digestive disorder Crohn's disease. Uveitis, inflammation of the iris, ciliary body, and choroid, produces pain, intense photophobia, blurred vision, and constriction of the pupil. There is usually an underlying disease such as rheumatoid arthritis. Glaucoma, the circulation of aqueous humor was described earlier in this chapter. If the aqueous humor cannot escape from the eye into the bloodstream, the fluid continues to be produced and pressure builds up inside the eye. The increased intraocular pressure interferes with the blood supply to the retina, causing death of retinal cells. Eventually, the optic nerve fibers are damaged. This condition is called glaucoma and is a major cause of blindness. Vision with glaucoma. Alright, cataracts. Cataract is a cloudy or opaque area in the lens. It is typically caused by deterioration of the lens due to aging, and it may be associated with diabetes and with cigarette smoke. It presents with blurred vision and photosensitivity, or may be discovered on routine eye examination. It is another major cause of blindness. This is cataract. The majority of cataracts occur in the center of the lens, but these associated with diabetes can be cortical, around the outside of the lens. Cortical cataracts can cause diminished peripheral vision and photosensitivity. The blurred vision obtained when a cataract is present is shown. So here's reading of cataract. Alright, so abrasion. Area of skin or mucous membrane that's been scraped off. Cataract, complete or partial opacity of the lens. Glaucoma, increased intraocular pressure. Intraocular meaning pertaining to the inside of the eye. Photophobia means fear of the light because it hurts the eyes. Oh. Photophobic is adjective meaning relating to or suffering from photophobia. And photosensitive adjective, an eye in which light induces pain. And photosensitivity, condition in which light produces pain in the eye. Macular degeneration. Degeneration of the central macula results in loss of visual acuity with a dark blurry area of vision loss in the center of the visual fluid. Macular degeneration. Ophthalmoscopic view of macular degeneration. This is vision with macular degeneration. Wow. There is photoreceptor cell loss and bleeding with capillary proliferation and scar formation. The condition can progress to blindness. Most cases occur in people over 55. Retinal detachment, separation of the retina from its underlying choroid layer may be partial or complete and produces a retinal tear or hole. The detachment can happen suddenly without pain. The patient sees a dark shadow invading his or her peripheral vision. The detachment can be seen on ophthalmoscopic examination. Diabetic retinopathy. This disease occurs most frequently in diabetes, whose blood sugar levels are not controlled. Some 50% of diabetics have retinopathy. In the early stages, microaneurysms of the small retinal blood vessels form. There are usually no symptoms. Later hemorrhages can occur, leading to destruction of the photoreceptor cells, rods and cones, and visual difficulties. Symptoms of diabetic retinopathy include blurred vision, dark areas of vision, and vision loss. Vision with diabetic retinopathy. Okay, papilledema is swelling of the optic disc due to increased intracranial pressure. It is not a diagnosis, it's a sign of some underlying pathology. It is seen on ophthalmoscopic examination. That'd be awesome, I'll ask. Papilledema is swelling of the optic disc due to increased intracranial pressure. It is not a diagnosis, it's a sign of some underlying pathology. It is seen on ophthalmoscopic examination. Cancer of the eye. Tumors of the skin of the eyelids include squamous cell and basal cell carcinomas and melanoma. Retinoblastoma is typically diagnosed at 2 years of age, rarely after 6 years of age. It is curable if diagnosed early and if it is not metastasized to other parts of the body. It has a 5-year survival rate of 96%. The condition can be hereditary. The first symptom is a white appearance of the pupil, a leukoria, a leukorrhea, with early detection and aggression treatment based on chemotherapy and laser surgery. 90% of cases are cured. In adults, the most common cancers are metastases to the eye from the cancer of the lung in men and the breast in women. Color blindness. Some people have a hereditary lack of response by one or more of the 3 types of cones and show color blindness. The most common form is red-green color blindness, in which these colors and related shades cannot be distinguished from each other. Night blindness is the inability to see in poor light. It is a symptom of an underlying problem that can be uncorrected nearsightedness, cataracts, retinitis pigmentosa, vitamin A deficiency, and glaucoma medications such as pilocarpine that constrict the pupil. Alright, leukocoria, reflection in the pupil of white mass in the eye. Metastasis, spread of disease from one part of the body to another. Metastases is plural. Microaneurysm is focal dilation of the retinal capillaries. Papilledema is swelling of the optic disc in the retina. Retinoblastoma is a malignant neoplasm of primitive retinal cells, and retinopathy is degenerative disease of the retina. Disorders of refraction. Far-sighted people are said to have hyperopia, in which only distant objects can be seen clearly. Because the eyeball is shortened, objects close to the eye are focused behind the retina and vision is blurred. Convex lenses are needed to correct the problem. Back to that convex corrective lens. And what the heck? Did I just reread all this? Oh my goodness.